It was just before the beginning of the lockdown. This couple was lucky enough to be allowed to stay together for the birth of their child. Now, for others, this unique moment might not be as perfect as dreamed. Amid coronavirus crisis, maternity services are facing unprecedented difficulties. This childcare assistant works in a hospital in Paris and preferred to speak anonymously. She told us how cases of COVID-19 among pregnant women who are about to give birth are handled. Strict measures are taken after the childbirth, even if they are not always easy to live with.
From the moment we have a suspicion about a mother, we test the mother, and as a precautionary measure, we separate them from each other. It lasts at least 3 days to be sure. We have done all the tests, and it can go up to 14 days if the mother is COVID positive. We try to maintain the bonds by sending pictures, by telling them what happens. It's difficult, because being separated from your child after his birth is not what we wish for.
More and more hospitals now also prohibit fathers from attending childbirth. This is not the case in the one where this healthcare professional works, but after the birth, precaution prevails.
After the childbirth, all visits are forbidden, so the father can see his wife and his child.
A crisis situation that puts additional pressure on healthcare professionals. I asked my source if there were enough masks for everybody from the beginning.
At the beginning, we didn't have enough medical equipment. We took our precautions as usual until we were asked to wear masks continuously, but we didn't have enough of them.
More medical equipment is now available and strict measures have been implemented to reduce the risks.
All the patients who arrive with symptoms or who are COVID-19 positive don't come through the same door. They have their own isolated space, and we're limiting the number of people coming in so we can use teleconsultation for the patients who are not having any major complications during their pregnancy.
It seems difficult at this stage to assess precisely what could be the risks of a mother-to-child transmission. But the death of a 6-month infant in the United States, a rare case, calls for the greater caution. Guillaume Petit, Euronews.